Okay, for this next case, the patient presents with a line on the right IJ. So we can see here the IJ, you can see the line within the lumen, and the compression picture, this is likely the line here. Flow around the line, and you'll notice that there's nothing, there doesn't appear to be any thrombus around the line, which is good for the patient, obviously. We have a somewhat pulsatile flow through the IJ. Moving on to the subclavian. Good color fill and pulsatile flow here. Moving to the axillary vein. You can see this is the artery vein here, compression. This is likely the axillary vein in the axilla, and spectral Doppler flow. And the sonographer labels the image as this is going to be a limited study due to bandages and the inability to access the cephalic vein in the distal forearm. You can see here just from the image there's a lot of edema, and the sonographer thankfully points out the vein here, and we can assume that is compressed on this side. And again, here is the vein, and this is classic sign of edema and the compression. And moving to the basilic in the forearm. And again, this is a limited study due to bandages. As we move to the proximal upper arm, they again point out the vein. You can see how small it is, and here's a compression picture. It's not visualized at mid or distal. And as we move into the brachial veins and artery and the basilic, we have the patent or open picture here in the compression. Mid. And you can see here, this is likely possibly a nerve bundle here. You can see it in this image as well. This is the artery and with the two veins and the basilic vein. And you can see that the veins are compressed. You'll just want to make sure that not to be confused at this area right here, which is likely the maybe a nerve bundle next to the artery. That is not a clot. And here's it with color, showing spontaneous flow. Moving on to the left side, picture of the IJ in compression and with color. These flows are normal pulsatile flow in the IJ and subclavian, and because it's moving into central veins, so you're going to see this type of flow that's normal. Here it looks like the vein is actually going out this way. It seems to be a strange angle that the sonographer takes, but this is veins, it's not arteries, so we're not technically angle dependent, but this could be cleaned up and possibly turn the box in the opposite direction. As you look here, you should be really paying attention to this area. You have nice color flow here. There's a small area where you don't see flow. You can see this might be a valve, which is likely a valve here, as you can see flow on top of this line, this little linear structure. But you'll want to pay attention to that. and good Doppler signals. As we get to the axillary, this patient, as the sonographer has put on the screen, has a history of an axillary DVT, and it nicely pointed out that there's something right here, and you can see it's demonstrated also with color. There's an absence of flow in this area. So they're stating that this may be, this is only a partially compressed vein. So again, that's in that same area. They have a history of clot, but this doesn't look too old. It's not bright. It's just barely seen. So that may actually be subacute. And now we move to the cephalic in the upper arm. All seems to compress. And whenever you get a lot of edema, sometimes it ends up making your picture very bright. So you'll just want to be mindful of turning down your overall gain. Moving through the brachials and the basilic. Could actually also decrease the depth here. It seems to be rather high up in the picture. Make your image a little bit bigger so that you can clearly see all the structures. And here we can say the sonographer says that it's not well visualized here at the mid forearm. So these are the arteries, and they're likely just due to edema. Vein may be compressed just because of the edema, or there may be some chronic thrombus, we're not sure. The best we can say is it's not visualized. And that's what you'll want to do. You'll want to make sure you just state what you see